Hi there. Today I want to talk about x-rays and whether or not you need an x-ray for back pain. So I get asked a lot by my patients who I'm treating with back pain, do you think I need an x-ray? Or I have a lot of patients who come in here and have been seeing somebody else who did x-rays on their back, okay? And so what I want to talk about today is an x-ray needed? Is it helpful in getting us to know what's wrong or determine our line of treatment? So big picture, if we look at the evidence, an x-ray for low back pain or for just neck pain is only really needed in very rare situations. So if you're in a car accident or you had a very hard fall on your back or your butt, some sort of impact, we may want to get an x-ray done. If you have a history of cancer and now you have an episode of pain in the spine that comes on gradually and you haven't been seen for your cancer for a long time, an x-ray may be appropriate. If you're having a fever or running a fever, temperature, we'd want to maybe get an x-ray to rule out an infection. Other than these things, an x-ray really doesn't help us determine what's wrong with your low back pain. Now, this may seem a little contrary to what you've been told, because you've been told that you have degenerative disc disease, you've been shown that you have arthritis, and I've written about this and talked about this quite a bit, but these are all just normal changes that happen in our body as we get older. Just like my beard is a little gray right now, it happens as we get older, we get some degenerative changes in our back. It's generally not, for sure, not the cause of pain because we see it in everybody, whether you have pain or not, okay? The other reason that some practitioners will do x-rays is on a false belief that they can identify an area of your spine that's out of place or malpositioned, and that they will then tell you that you need treatment to help put this back into place. And you know that it's so common. I see a lot of people in here who have been treated for that type of thing. You have an x-ray done on your back. They show it to you. They come out and say, this is where you're out of alignment. You're going to need who knows how much, 12 visits or 24 months of treatment to get this back in place. And so I think in those cases, x-rays are used more as a marketing protocol or marketing method to try to get you to buy into treatment, to buy a package of treatment that probably is not needed and is really probably extravagant. So if you're just having back pain or neck pain, no arm pain, no lower extremity pain, no pain in your legs, x-rays aren't needed as long as you don't have a history of cancer, not running a fever, or haven't fallen or had an impact to your spine. So back pain can be treated, neck pain can be treated without the need for x-rays. You can do very well. It usually does not help us to identify the cause of your pain, despite what you may have heard. So don't rush out and get x-rays. If they're recommended at a chiropractor's office, at your MD's office, and you're not having any of those things that I talked to you about, tell them you don't need them and just find some treatment for it to try to help. So reach out if you have any questions, but I hope that this helps you not get x-rays that you don't need. Thanks.